There are two basic activities that just about every living human being does on a daily and regular basis: eating and sleeping. It's no wonder that there is a section of the DSM-5 devoted to eating and sleep-wake disorders. Even without a diagnosed condition, we've all experienced periods in our lives when our eating and sleeping patterns have been erratic or out of sync. Consequently, we have become aware of how important these two processes are to our normal daily functioning. Keep this in mind as we move through the module. All eating disorders share common characteristics related to significant deviations in eating behavior that are largely driven by distorted thinking about shape and weight. Eating disorders are also heavily influenced by social, cultural, and psychological factors. The two main types of eating disorders are anorexia nervosa and bulimia nervosa. Both include severe disruptions in eating behavior, as well as disproportionate influences on the self-concept related to weight and shape. Anorexia and bulimia affect significantly more females than males, with a lifetime prevalence of around 1% for each disorder. These two disorders have strong socio-cultural origins in westernized areas, where there is an emphasis on thinness. Anorexia nervosa. Anorexia nervosa involves restriction of caloric intake. It is marked by extreme weight loss, a weight that is 15% below what is expected for body type, and an intense fear of weight gain or losing control over eating. Simply put, this disorder is deadly. When an individual severely restricts caloric intake, the body must borrow energy from the internal organs. Bulimia nervosa. Bulimia nervosa involves eating excess amounts of food in a short period of time, and becomes an act that is associated with guilt, shame, and regret. Most often, people purge and induce vomiting, while other less common methods include excessive exercise or fasting and food restriction. Individuals with bulimia nervosa are likely to be within 10% of normal body weight, yet can suffer from severe medical problems related to electrolyte imbalance, kidney failure, and cardiac arrhythmia. Similar to anorexia, bulimia nervosa includes being overly concerned with body shape and a fear of gaining weight. Binge eating disorder. Binge eating disorder is a new diagnosis in the DSM-5 and involves binge eating without the associated compensatory behaviors. This behavior is often associated with distress and functional impairment, for example, health risks and feelings of guilt. Media and cultural considerations related to how thinness is portrayed in popular culture, and a strong emphasis on dieting, are contributing to the causes of eating disorders. While embracing an integrative model, these cultural considerations, as well as psychological and behavior components, can help psychologists and mental health professionals better understand and treat these disorders. The psychological and behavior components are related to perfectionistic attitudes, distorted body image, and a preoccupation with food. Treatments. For all eating disorders, psychosocial treatments based on cognitive behavioral therapy can be quite effective. Individuals learn to identify maladaptive thoughts and behavioral patterns, while also practicing new habits related to food. Antidepressants and other medications can be effective in the short term to reduce binging and purging behavior. Psychoeducation with components to target food, weight, body image, thought, and emotion are important. Obesity, while not in the DSM-5, affects over 1/3 of Americans, leading to health complications. Obesity treatment often follows a process of beginning with self-directed weight loss programs to behavior modification and bariatric surgery. All sleep-wake disorders are generally marked by an interference with the normal process of sleep and waking, and are largely influenced by psychological and behavioral factors. Let's examine the two main categories of sleep-wake disorders: dysomnias and parasomnias. Dysomnias affect the amount, quality, and timing of sleep, while parasomnias include abnormal behavior and physiological events during sleep. Impact of sleep-wake disorders. Why is this important? Just a few hours of sleep deprivation can decrease immune functioning and affect our daily functioning. Energy, mood, memory, concentration, and attention processes can all suffer as a result of lack of sleep. Sleep-wake disorders are often assessed through polysomnographic evaluation that includes measuring brainwave activity, eye movements, and muscle movements. Let's examine the different types of sleep-wake disorders. Insomnia. Insomnia is one of the most common disorders and involves problems initiating or maintaining sleep. While 35% of adults report daytime sleepiness, insomnia is only officially diagnosed as a sleep disorder when it is not better explained by a different condition. In addition, sleep difficulties must be present for at least 3 nights a week for 3 months or more for a diagnosis of insomnia. Cognitive behavioral therapy can be especially useful for insomnia to provide psychoeducation about sleep, encouraging the use of a sleep diary, and generally just practicing better sleep habits. Hypersomnolescence. Hypersomnolescence disorder is defined as sleeping too much or excessively sleeping. It can manifest as long nights of sleep or frequent napping. For hypersomnolescence, sleep difficulties must be present for at least 3 nights a week for 3 months or more. Narcolepsy. Narcolepsy is a rare condition that involves a recurrent, intense need for sleep or lapses into sleep and napping. It is accompanied by episodes of cataplexy, i.e., sudden loss of muscle tone with maintained consciousness, hypocretin deficiency, or going into REM sleep abnormally fast. Sleep apneas. Obstructive sleep apnea hypopnea, central sleep apnea, and sleep-related hypoventilation are 3 disorders involving abnormal respiratory patterns during sleep. These were once previously classified as parts of the same disorder. Individuals who suffer from these breathing-related sleep disorders are usually minimally aware of apnea problems and may snore, sweat during sleep, or wake frequently. For breathing-related disorders, weight loss and mechanical devices can aid in facilitating sleep. Relaxation and stress reduction can, of course, assist with sleep as well. Circadian rhythm sleep-wake disorder. Circadian rhythm sleep-wake disorder involves disturbed sleep that leads to distress or functional impairment and is due to the brain's inability to synchronize day and night. The brain's biological clock, the suprachiasmatic nucleus, stimulates melatonin and gets the body ready for sleep. Shift work and a family history of dysregulated rhythms can contribute to abnormal circadian processes. Non-REM sleep arousal. Sleep terrors and sleepwalking are considered to be a part of non-REM sleep arousal disorder, and the individual experiencing them has no memory of the episodes. Both problems are more typical in childhood. Nightmare disorder. Nightmare disorder includes repeated episodes of extended or extremely dysphoric dreams that lead to distress or impairment in daily life. REM. REM sleep behavior disorder involves repeated episodes of arousal during sleep that can include vocalization or complex motor behaviors. This disorder can lead to injury of the self or sleeping partner. Sexual dysfunctions related to desire, arousal, and orgasm are common and not always distressing. Let's examine some findings from research. There is research to suggest that at least 40% of men have had some difficulty with erection and ejaculation, while more than 60% of women have experienced problems with arousal and orgasm. Sexual dysfunctions can be lifelong or acquired, generalized or situational, based on psychological factors alone or psychological factors combined with medical conditions. In both male hypoactive sexual desire disorder and female sexual interest arousal disorder, there is little to no interest in any type of sexual activity. Female orgasmic disorder involves a marked delay, absence, or decreased intensity of orgasm in almost all sexual encounters that cannot be explained by relationship distress or other significant stressors. Genitopelvic pain penetration disorder involves difficulty with vaginal penetration during intercourse and can also be associated with fear or anxiety about pain during sexual activity. Premature ejaculation is a condition where ejaculation occurs within 1 minute or less of penetration and before it is desired. It is the most prevalent sexual dysfunction for adult males. And finally, erectile disorder involves difficulty achieving or maintaining an erection, while sexual desire usually remains intact. Assessing sexual dysfunction. Assessing sexual dysfunction involves a thorough and careful review of sexual history, a medical examination to rule out potential medical causes, and may even include a psychophysiological component. Sexual dysfunction is often the result of a combination of biological, psychological, and sociocultural contributions. Negative or traumatic sexual experiences, as well as anxiety and negative thoughts, may all have an impact. Education about sexual responses, foreplay, and other appropriate sexual experiences can be surprisingly effective. There are few medical procedures for female sexual dysfunction, while there are many more treatments for erectile dysfunction. Paraphilic disorders are different than sexual dysfunctions. Paraphilic disorders involve misplaced sexual attraction and arousal focused on inappropriate people or objects. It is important to remember that these are only considered disordered when an individual experiences significant distress or impairment, or when someone acts on urges with a non-consenting person. The following are all paraphilic disorders: fetishistic disorder, voyeuristic disorder, exhibitionistic disorder, frotteuristic disorder, transvestic disorder, sexual sadism disorder, sexual masochism disorder, pedophilic disorder. Treatment. In the treatment of paraphilic disorders, psychosocial interventions are usually behavioral in nature. The goal is to actively target deviant and inappropriate sexual associations. Sensitization and orgasmic reconditioning may be used to shape sexual arousal to more appropriate adult stimuli.